If your TSH is elevated, don't panic, but don't assume it tells the whole story either. TSH, thyroid-stimulating hormone, is released by the pituitary gland to signal the thyroid to produce more thyroid hormones, mainly T4 and T3. When TSH is high, it often means your thyroid isn't producing enough, a condition called hypothyroidism. But here's where it gets interesting. TSH is just a messenger. It rises in response to low hormone levels, not necessarily due to a thyroid defect. To understand what's really going on, you need more than just TSH. That's where free T4 and free T3 come in. Free T4 is the main hormone made by the thyroid. Free T3 is the active form, converted from T4, that actually does the work in your cells. If TSH is high but free T4 and free T3 are normal, this could indicate subclinical hypothyroidism, a gray zone where the body is struggling to maintain balance, but symptoms may be subtle or absent. Then there's anti-TPO antibodies. These test for autoimmune thyroid disease, most commonly Hashimoto's thyroiditis. If anti-TPO is elevated, the immune system is attacking the thyroid tissue. Even if T4 and T3 are still normal, damage may be accumulating quietly over time. Now, here's what's often missed: the adrenal glands. Chronic stress can elevate cortisol, which interferes with the conversion of T4 to T3 and can blunt thyroid hormone action at the cellular level. Low adrenal function, often from prolonged stress or burnout, can even mimic hypothyroid symptoms like fatigue, brain fog, and cold intolerance, while your labs appear normal. This hormonal interplay is complex. A high TSH might start with the thyroid, but it doesn't always end there. Without assessing full thyroid panels and adrenal function, you risk treating symptoms without understanding their root cause. This video is for educational purposes only, and not a substitute for medical evaluation. Subscribe and join our channel where you can learn every day.